Hi everyone, I'm Patrice Jones. I'm the Vice President and Chief Nursing Officer here at UF Health Jacksonville. And to all the nurses out there, I want to say a big Happy Nurses Week. I so appreciate each and every one of you. You do such a great job coming to work every day to take care of our patients with kindness and compassion and professionalism. And I can never tell you enough how much we appreciate you. Our vision in nursing is to exceed the benchmarks for patient safety, quality, for the patient engagement, and for our staff engagement. We couldn't do that if it wasn't for our partners that we work with in the hospital, the other disciplines. These partnerships are critical, and we appreciate all of you for partnering with us to help us care for our patients. Another thing I wanted to talk to you all about is that this year has been proclaimed the Year of the Nurse. This proclamation was from WHO, the World Health Organization, and it's in honor of Florence Nightingale. It's her 200th birthday. We are going to proclaim this year as the Year of the UF Health Nurse. Another goal of our organization is to become one UF. I feel that nursing has already made great strides towards this goal. So what does one UF Health mean to you? What does it mean to me as your CNO? It means our critical partnerships that we have with our colleagues in the University of Florida College of Nursing and with our partnership with our nursing colleagues at Shands Hospital. We have a very successful academic partnership program with our APUs. We also partner with our Shands colleagues for our magnet designation, many things for informatics, and a lot of information sharing. So I feel like nursing is well on the way towards this goal of one UF. Another great thing about this year that I'm excited about is the fact that this is our year that we will be designated magnet. So I hope that you will all remember that magnet is what we do. This is our third designation, which is a big deal, and I know we will all join in great celebration for that. So please remember, together we can do more, and I appreciate all of you, and Happy Nurses Week.
One UF is a concept that kind of incorporates the idea that we all work together for the end goal of helping the patient leave here in as best shape as possible. It's not just nursing that allows that to happen. It's not just physical therapy. It's not just physicians. It's all of us working together, doing what we do best. And I think, one UF is just all of us coming together to do that.
One of the things that I think about when you say one UF is, and you can't advertise for this when you're applying for a job, but there's a familial
I would agree. The family thing is strong.
Yes, there's a familial sensation to working here. She knows my children's names, not because she has to, but because she wants to, because when she works with my wife and I, she has a desire to do that, because we have a connection with each other that you don't have in a lot of other institutions.
Oh my gosh.
Tell the truth.
Techs are the backbone. I have felt overwhelmed so many times and been in a room, and patients don't always see, I know we wear different color scrubs, but to a patient, it doesn't matter if you're a doctor, a nurse, or a transporter. When they need something, they're gonna ask whoever, they're gonna need whoever, but my techs are amazing. I couldn't literally not do my job without them.
I appreciate her support. The nurses are great at supporting us, great at, if we have a crazy idea, if we're really trying to push a patient that maybe hasn't tried to stand yet or tried to walk or anything like that, we're like, all right, this is what we're gonna try, we're really excited about it. The nurses are always supportive, always ready to do it, always, willing to collaborate with us. And it's really nice to have that supportive environment because we make so much more progress when everyone is on the same page and positive about it.
When something happens in our family, we take care of that person. We don't ask questions, we don't ask why, we don't ask what you need, we show up with stuff.
We're just there.
And that's just the environment that's been garnered here by the people that have come before us. And we're trying very hard to teach the new generation that will come behind us that very same principle, because that's one of the things that makes this place great. And that's why we work so well together. And I feel like that pours into our patient care.
People say it's a thankless profession, but I really don't agree with that. I always have patients and family members come up and thank me, and that's an awesome feeling. And even when they don't, I know when I'm appreciated just by when a patient, especially when they're in pain, and I know that I've helped resolve their pain. It also means taking the time to thank the nurses who came before me, my preceptors in nursing school, thanking them, because I wouldn't be here without them. They helped train me, they helped guide me into the role I am in today. It's not just about feeling like I'm appreciated, it's appreciating my colleagues beside me. Any nurse in that's ever been a nurse or will be a nurse. It's about taking the time to thank them and appreciate them.
Whether it's a nurse in a solid position or an advanced practice nurse, as Dana is, all of that just takes it all back to the physicians, the caretakers, the physical therapy, the occupational therapy, all the other divisions of multidisciplinary caregiving are extremely important, and they are without a doubt the piece that allows that patient to get well and go home. But without the nurses at the bedside, there would be a great loss of the patient's stability, and probably even their recovery would be missing. We add the nursing side, and that always complements what they're doing. I think that nurses have been an amazing thing over the years. We will continue to do that, and I think it's really outstanding to be recognized for that.
So Nurses Week is a time to celebrate all of you, and I want to thank you for what you do every day for our patients, for your bravery, your perseverance, especially during this pandemic. And to all of our colleagues out there, thank you for all your work with nursing. It is in times like these when the power of One UF really shows. Thank you.
As the CEO of this organization, one of the things I'm most proud of is our nurses and our nursing staff. It is one of the great things for me to work in an organization that's Magnet certified. It's been recognized several years. We're going for Magnet again once we get past this pandemic. And so for me, that makes everything I do and the physicians that we work with, it makes it so much better for us to know we've got a great nursing team to work with us. So I'm really proud of all the things you do. This pandemic changed our lives, really upset everything that we're doing, but you jumped right in, you took hold of our patients, you cared for them, you went into danger on some level. We didn't know the extent of what's going to happen, and so I'm proud of everything that you're doing and proud of everybody that's working with you. So Patrice is a great leader for you, and it's great for me to work with her on a regular basis, and so I sleep well knowing that I've got a great nursing leader and she's got a great nursing team. So thanks for everything you do.
Happy Nurses Week.
Happy Nurses Week.